Basically, I'm very interested in how the overarching quality and push towards quality is affecting populations differently. So there's been this overarching push with the Affordable Care Act to basically decrease hospital readmissions. And the thought is, if someone comes into your hospital, they have a problem, they go home and they come right back, you've sort of not handled that problem appropriately. And so there's been a really big push to decrease readmissions. And that argument sounds very simple and straightforward, but it becomes a little bit more complicated with that with ovarian cancer, because there's a difference between short-term morbidity, what happens to you in the 30 days following surgery, and what happens to you over a long period of time. And specifically for ovarian cancer, aggressive surgery that's associated with more complications and basically a resection to no more disease, no gross residual disease, is associated with improved long-term outcomes, but increased rates of complication. And so it's an incentive that may be affecting our population differently. So I looked specifically at neoadjuvant chemotherapy, which is a new technique that basically in all the trials has been shown to decrease surgical morbidity. If you give the chemo first, the surgery is not as complicated, and so your complication rates, readmission rates, no one's looked at readmission rate yet, but what I'm presenting shows that those go down as well. And so the point is that if this overarching system, sort of hospital administrators, Centers for Medicare and Medicaid Services are really pushing us to decrease readmissions, are we going to change how we care for women with ovarian cancer, and is that the best thing for them? And that's really the question that abstract is posing.